New rules are going into effect when it comes to hospitals discharging homeless patients. KSBY News reporter Alexa Bertola is live this evening in Santa Maria with how it's impacting local hospitals. Alexa.
Scott and Karina, the new law requires that hospitals follow a few guidelines before they discharge homeless patients. Now here's a list of the guidelines that the nurses must follow. It went into effect just 23 days ago for all hospitals within the state of California. A new year and new requirements for hospitals.
Provide them with clothing, provide them with a meal, and basically make sure that they're not just thrust out into an environment that really isn't safe for them.
Health consultant Joel Dieringer will facilitate a meeting on Friday with SLO County hospitals on Senate Bill 1152.
It was part of a statewide problem where there have been instances around the state where patients who were in the hospital or in the emergency room were just sort of discharged to homeless shelters without any advance notice, let out in their hospital gowns without any support.
We talked with the California Pan-Ethnic Health Network in Sacramento, who sponsored the bill.
We're not requiring hospitals to build housing. We're not requiring any of that, but we are saying, take advantage of the resources that exist and help the people who are running those operations, help them help you.
Our local hospitals in San Luis Obispo and Santa Barbara counties told us they already had a lot of the protocols in place, now required by law. But what's new is that they never had to write it down on paper.
It guides the nurses through the discharge process.
Lompoc Valley Medical Center says it's prompted them to pay for some respite beds at the Bridge House homeless shelter. They can also send a nurse out there if needed. Who pays for that?
Right, so we have a grant, a Prime Project grant, and that's how we're paying for it right now. It's a 5-year grant.
Overall, it really should save some money, because what's happening now is homeless people are being discharged to the streets, and there's a revolving door where they end up back in the emergency room.
And the hospital says it will now be able to better understand how much money it's spending on homeless treatment now that documentation is required. For now, live and local in Santa Maria, Alexa Bertola, KSBY News.
Thank you, Alexa. The hospital says it's been training on the new policy since September.